Hi, good afternoon, everyone. Thank you for joining the Medical Marijuana Testing Advisory Council meeting. It's great to have you all here today. We're going to start with our welcome and call to order. My name is Jessica Rigler. I'm the chairperson for this committee, a member of the Arizona Department of Health Services, assistant director here. And I know many of you, so thank you. Welcome back to our council meetings. We'll start with our roll call so that we can confirm that we have quorum. And then from there, we'll go on with the rest of our agenda. Just as a reminder for some housekeeping items, if you can keep your microphone on mute unless you're speaking. And if we don't hear you right away, we may just prompt you to unmute yourself. Okay. So starting with roll call, Sam Richard. Sam, can you unmute? Are you seeing him on there?
Yeah, I see him on there.
Okay. Okay, Sam, it seems like you're on. We just can't hear you. Yep. Okay. Ryan Tracy?
Ryan Tracy's here.
Got you. Thank you so much. Steve Cottrell? Steve? Okay. And Murray Stein?
Unmute. Present.
Hi, Murray. Thank you.
Aye.
Matthew Lascala?
What?
Did I hear you, Matt?
Yes, we can hear
Hello?
you.
Can you hear me now?
Yes, thank you so much.
Sorry about that. Thanks.
No worries. Andrew Provencio? Andrew? Okay. And if I mispronounce anyone's name, please feel free to correct me as well. Tabitha Howard?
I'm here.
Thank you, Tabitha. I don't believe Hope Jones was able to make it today. Hope? Okay. And Joseph Demena?
All right.
Oh, yep. There's Joe. Can you unmute? Yeah, let's see. Can we hear you?
Technical difficulties. I'm here. Hello.
Perfect. Thanks, Joe. And it looked like I just saw Andrew. Andrew, are you on?
Oh, I just said yes.
Perfect. Thank you, Andrew. Jay Neary.
Yes, Andrew is on.
Okay. Thank you, Andrew. And Jay, are you here?
Hi, yes, Jay's here.
Thanks, Jay. I don't believe that Vince was able to join us today. Just double checking for Vince. Okay. And Zhangguo Shang.
I'm
On?
here. Yes, I'm here.
Can you correct my pronunciation, please?
中国熊. That's
Okay.
okay. It's just,
Thank
I know it's hard.
Thank you. And Maxwell Lung? Maxwell here? Yes. Oh, we see you.
Oh yeah, yes. Thanks. I couldn't unmute myself. So
Yeah, it wasn't letting us unmute.
yeah.
Got it. Okay. We can hear you now. Thank you.
Thank you.
Alvin Altamirano.
I'm here.
Thank you, Alvin. Good to see you. And Ty Garber. Yes, we have Ty on the phone. Ty, we can't hear you.
Yeah, I'm here. For some reason, sometimes when you try to unmute, it says
the host is not allowing you to unmute. So,
Okay.
but I was able to do it that time.
Got it. Thank you. And I think
Uh-huh.
we're going to get that resolved as well, but please feel free to raise a hand or pop a question in the Q&A box. We'll be monitoring too in case there's some challenges that pop up. Thank you all for being flexible with this format throughout the pandemic. I'm sure all of you are very well versed in every virtual meeting platform there is out there. So we are appreciative of you for joining us today in this virtual meeting. We do have quorum. I can confirm that. So we'll kick off and move forward through our agenda at this time. First, I'd like to just review our charge today. Many of you were on our previous version of this committee, but welcome to those of you who are newly joining the committee with some legislation that was passed this last legislative session. There were some additions to the committee. And so we've got some new members here, most notably representing the universities, as well as a laboratory conducting proficiency testing in Arizona. So we've got some new members there, but we're really happy to have y'all join us. The committee at this time is charged with conducting an annual review of the marijuana testing program. And to that end, we will have a report that we need to submit to the legislature the second week in January. And so the purpose of this meeting is to really talk through what the annual review should look like so that we can get these items taken care of, discussed, get them into a discussion status for all of us and do some voting on things at our next meeting. So the three areas to touch on are an assessment on whether an analyte should be removed from the statutory testing panel. And so we've got that on the agenda today, some discussion or recommendations of analytes to be removed. So thank you to those of you who have submitted information for discussion on that. We are also required to take a look at the number of statements of deficiency related to testing and the remediation efforts that were made on that. And so we'll have some programmatic presentations to talk through some of that. We're joined by Megan Whitby from the Marijuana Dispensary program and Steve Baker from our laboratory program here at the department to review that data with all of you. And then finally, the new legislation has us tasked with looking at any other recommendations for improving the testing program. And we have had some submissions from many of you on some recommendations for that too. So we'll be discussing those today as well. Is there anything I need to do with that? Okay. Perfect. So I think most of you should have the agenda in front of you. I'd like to remind you all from housekeeping purposes, this is a public meeting. It's being recorded. And so it will be posted on our website at a later date too, following this meeting. The discussions we'll have here today are very important and they will inform votes that we'll be taking at the next meeting that will relate to the report that we have to issue to the legislature. And so we appreciate all the preparation all of you have done in advance of this meeting, as well as your attention through these next 2 hours. We have a lot on our agenda today. First, we're going to start with the discussion of analytes to be removed and then go into discussion of the deficiencies that have been found over the last year or so, and then any additional items as necessary, and then we'll wrap up the meeting. Again, just thank you very much for your time. In order to keep us on track for our 2-hour time limit, I may need to request that you shorten comments so that we move on to the next topic. But your discussion, thoughts, input are very welcome through all of this. Are there any questions before we dive into the agenda? All right. Great, fantastic. Well, let's get started then. So next up is our discussion of recommendations or analytes to be removed from the statutorily required testing panel. We have 3 that have been submitted, 1 related to Aspergillus, 1 related to the pesticide panel, and 1 related to the residual solvent panel. So we're going to start with the discussion of Aspergillus, and I'll turn it over to Joe to introduce this topic for discussion among the committee. Joe Dimena.
Awesome. Thank you very much. Appreciate it. And just to preface, the beginning of this discussion, I am charged as the registered qualified patient on the council, and by no means am an expert or a scientist or any of that stuff. So I really am just elevating this particular issue for the experts on the council to talk a little bit about. But it's my understanding that Aspergillus has been somewhat problematic for labs, for dispensaries, and for patients in general. I'm not sure how other states handle this particular analyte or testing of it, but just wanted to throw out there, is this something that maybe we should consider removing and putting a warning on, saying if you're immunocompromised, this may contain Aspergillus. That's just one idea. Wanted to kind of kick it out to the group and see if you all had any thoughts on that.
Thanks, Joe. So we'll open it up then to committee members for discussion or insight on that particular topic. If you're having trouble unmuting yourself, please raise a hand or ask a question and we can try and troubleshoot with you.
And I guess let me just kind of do an additional sort of comment or question. Is this something that should be tested? I mean, would this potentially put patients and customers at risk? Because if so, then, you know, we should just continue on. But I'm really hoping to get some expert opinions on this one, please.
Hi, Joe. This is Maxwell from from ASU. I got a quick question. So are you talking about like aspergillus? Are you talking about aspergillus species as a fungal contaminant, or are you talking about the mycotoxin produced by aspergillus, like aflatoxin, B1, B2, G1, and G2?
And
they're not the same. Yeah, just want to clarify.
Yeah, and I would say that's where you lose me a little bit, because like I mentioned, I'm definitely not the microbiologist or scientist or anything. So maybe the experts could step in here and answer that.
Yeah, this is Ryan Tracy with C4 Labs. I believe what Joe's referencing here is the aspergillus testing on flour, the mycotoxin testing that's taken place on concentrates. Obviously, I think those are the deleterious health concerns and ones that need to be maintained, the mycotoxins. To Joe's point, it is, I think, an issue that we've seen quite often. And I would say if there's one microbial contaminant that we find more than others, and that causes retesting and multiple laboratories to have to take custody and do the testing, it definitely is the aspergillus that is causing that. And it is difficult because there is a lot of cultivators and people that may be battling issues within the growing environment. And they're doing a kill step and doing what is needed to maintain it being safe. But a lot of the people are utilizing qPCR to do the detection without speciation, and you're finding both dead and live DNA. So if there was a kill step being done, we are picking up that dead DNA. Now there is products out there to strip that dead DNA and hopefully only leave live and viable DNA. But without us knowing that needs to be done or that a kill step was taken, I believe there probably is some positives coming out where it isn't a true health concern if the DNA itself is dead and not viable. I don't know, Tabitha, if you're seeing the same thing, you certainly can speak more intelligently to what you're seeing and kind of the concerns there. But that's what we're seeing here in our lab is that definitely is the most predominant microbial contaminant and something that probably has the highest rate of failure from a micro standpoint.
It does, and retest, correct.
This is Steve Cottrell representing the industry associations. Personally, as a retailer, I feel it is an imperative for us to continue to test for this. This is the one harmful area with people with compromised immune systems. This can affect them wholeheartedly straight away at that. I don't think personally this should be up for negotiation.
Yeah, I would second this comment as well. So there's a study in 2016 talking about aspergillus species can in fact immunocompromised cancer patient. So this can be really dangerous. The fungus can get into the airway and infect the patient. I mean, it's very dangerous if you have this in for medical use.
This is Sam, and I'm great conversation. Also grateful for the opportunity to serve on this council. I'm here representing the Arizona Dispensaries Association as its executive director, and I think you'll see some of this conversation happen later in the agenda. But the way that we would approach this question is the different programs of medical versus adult use programs, and I think from an operational standpoint, it makes the most sense that the two tables are as similar as possible. And I think from that perspective, I think that we've seen in some other markets that, and to Maxwell's point and others on the panel, Aspergillus is absolutely something that needs to be taken seriously. And in other markets, they do that through a posted warning or a warning that's affixed to labels, alerting any inhalation of cannabis has increased risk of certain things like Aspergillus, and those who are immunocompromised should not inhale cannabis. And that posted warning was enough justification for those markets, and that being Oregon and a handful of others, to actually remove Aspergillus from the list of analytes that are tested because of some of the other things that are shared, that while it is absolutely a harmful analyte, it is relatively rare that it is found and detected in a way that could be harmful to most consumers, with the caveat that immunocompromised consumers can absolutely have poor health effects from doing that. So I think from this perspective, we would absolutely be in support of a removal of Aspergillus, but only with the caveat that there are a posted warning in a retail environment, or consideration of additional warnings, either affixed to the label or other solutions that could communicate the potential dangers of Aspergillus. But again, I just want to emphasize that the reason, the kind of the impetus for where you'll hear a lot of my comments come from today, is that the two programs of medical and adult use, from an operational perspective, should be as similar as possible, if not exactly the same.
Yeah, whereas the warning, I can see where we come from in that suggestion, but I don't know that it does enough for the consumers. I don't know how many patients and consumers are out there reading the fine print. And I think when it comes to patient and consumer health and safety, we should err on the side of caution. And being that it is something that we see systemically throughout the industry, and are continuing to see, I don't know that it's appropriate at this time to remove that analyte. It's too big of a concern. It's one that can really hurt and potentially kill people that are immunocompromised, and I don't think we can rely on the fine print to prevent that.
Hey guys, this is Jay Neary. I just wanted to ask Ryan and maybe Tabitha, can you guys give us an idea of how many failures you have? Like, not, a percentage, 50%, 20% out of everything you've been doing this year for Aspergillus?
Yeah, I can't be exactly exact on that, but I will say it's the highest rate of failure that we see in the micro department. We probably saw 8 to 10, maybe more just last week. So we see probably a dozen or more failures a week on Aspergillus.
Hi, this is Zhongguo Xiong. Can I ask, what is the test? Are you testing for the generic Aspergillus, or the species, or specific ones? Because there are many species of Aspergillus around in the air and everywhere, but there are only a few species that actually are human pathogens. So another way to look at this is that if we test specific species of Aspergillus, only maybe 2 or 3 species that can be human pathogens. That way, then you would eliminate all the other Aspergillus contamination that would not cause infection in immunocompromised individuals.
Yes, we currently test for 4 different species, and they are those four deleterious concerning species.
We test for 4 as well, and it's our rate is about, from all the samples we test, about 5% are positive for Aspergillus. Give or take.
This is Murray Stein with Halo Infusions. I just want to make one comment, and I totally agree with most of what's been said about Aspergillus and not taking it lightly. I will say that if you would like to put a warning on products, remember that there are consequences for that warning. One is the enormous investment that everybody makes in their customized packaging. So they might likely put that warning on the customized packaging. There can be a 3-month minimum cycle to have that packaging produced, and you might be sitting on a lot of it. If you'd like to put it on the label, you apply at the point of sale or through your weights and measures or what have you, it often, that kind of thing will get lost and there's not very much space on it. So should you elect to put a warning on there, and I can understand why the benefit of that is, then I would definitely, the state's got to give due consideration to any changes like that that are going to affect product packaging, flour, edibles, or otherwise. We need at least some period of time, and it needs to be communicated effectively to the dispensaries and therefore to the customers that that warning is not required for some period of months, so we can catch up with the packaging. This has been a problem in the past with changes, and it's cost us a lot of money, and I'm sure a lot of other suppliers money as well. We need to have time to implement those changes, and the state needs to be better communicating when those changes are coming. Just wanted to add that that comment. Thank you.
All right, thank you, everyone. Thank you, Murray, and all for your comments related to Aspergillus testing. I'll ask at this time if there's any motion that anyone would like to make related to removal of Aspergillus testing from the testing panel. Okay, hearing none, we'll move to our next agenda item then, related to the pesticide testing panel, and I'll turn it over to Tabitha. Thank you.
Real quick, going back on the microbial part, did you guys get my note about the question about the testing for generic E. coli versus the pathogenic E. coli?
We did. Yeah, it's on the agenda farther down related to other discussions of testing recommendations.
Oh, okay. I'm sorry, I didn't see that. Okay, just didn't want to miss that part. Pesticides. I would like to suggest a removal of I cannot pronounce these for the life of me, acetoquinosyl, because we have a lot of issues with that one, and mostly because the exposure of water changes the structure of that compound into a pesticide that we do not test for. Assuming that this is plant material and that they are watering their grows, most likely they're not going to have that compound because it is going to break down. And also because some laboratories use water as a solvent and it's going to break down anyway. So this one's a really hard analyte to test for, and you're not going to see it anyway because of the denaturation of that compound. So I would like to ask if we could consider removing that one. And then also for the pyrethrins, there's 4 that we test for. We're thinking we should only test for 1 and 2 because jasmine and cynarin, I think that's how you say it, is not very popular one, and you can only get, it's not likely it's going to be there. And because in the standards, it comes at a very, very low percentage, and it's really hard to calibrate and test for that accurately just because the percentage that comes in all the standards when it says 4 pyrethrins. Another one is, the last one would be Corvos. We have not had a single detect for that, and because we have to run that on a different probe or a different instrument, most likely to get it to pass all the QC all the time, I'd like to suggest removing that one as well. But I mean, the other labs, I guess, would have to support that there are no detects throughout the history of us testing for the last year for all those 1, 2, 3, 4 compounds.
Tabitha, can you repeat that last compound that you named?
Dichlorvos.
Okay.
And typically it's ran on a different probe or GCMS instead of the triple quad, just because it is a problem child. And it's been continuing to be an issue for us to be able to run all 60 analytes, because how many there is at one time, without having to use another instrument to get that one to pass consistently all the time without having to recalibrate for it.
Yeah, and, just to echo what Tabitha said, C4 is in full support of what she mentioned, and specifically the pyrethrins we're seeing, the other 2 compounds she mentioned. And just to give some insight as to the impact that this has from a capacity and turnaround standpoint on the labs, if our closing batch QC fails for any of those compounds or outside of the recovery limits, we literally lose a day and a half worth of work and sample prep, and it really causes the bottleneck. And specifically the compounds she mentioned, I can speak certainly for C4, we're in full support of those changes being made. And I think it would aid us in our ability to turn things around and have less batch failures. So fully in support of what Tabitha's saying here.
Yeah, Thank you, Ryan, for that. Yeah, and I'm not just suggesting them just to remove and have less work for us. They do cause a lot of samples to be held up because we have to re-extract the entire batch of samples and go through the whole same process for all the compounds, and just that that one fails in particular, or any of those compounds fail in particular, or curve or quality control measures. Everything has to be redone. And like I said, for the last year and a half that we've been running compliance regulated samples, we haven't had any detects for those compounds at all, but continue to struggle with those and have a later turnaround time in most cases for one of those failing at least.
I would like to add that, you know, this pesticide list that we pulled a number of years ago was straight out of Oregon and Washington, where there's a lot of Christmas tree farming. There's a lot of other agricultural things that components that which were part of the reason for adding these analytes to these tests. So as we've seen over the years, many of them are benign here in Arizona and not used. And I support that measure as well.
There are a lot of pesticides that we typically do not have detects for, but are not as a burden to test for. But Steve is right. This list, there's only a select few that we see repeatedly. So it would be nice to get some kind of, I don't know, in the future to determine the whole list, if it's really applicable to Arizona, what we've seen detects for, even at our lowest calibration point, not at the MAL. When I suggest these aren't even, you know, not even a blimp in the baseline. I'm not saying that these have ever had detects that have become failures before that I suggested, but I haven't even seen a blimp in the baselines for these. So they're not even detected at all. But there's numerous pesticides like that are not a huge struggle to run, but definitely a tedious list to be tested for when we haven't seen anything for them at the MAL or at our reporting limits, which are much, much lower than what the MAL is.
Other thoughts, questions, or discussion related to the pesticides?
I'd like to add from a proficiency testing perspective that when we do physically include any of those three that Tabitha has mentioned, we really do have a pretty high failure rate in the study.
Can you please elaborate on what you mean by failure rate?
Labs either doing a non-detect on something that's physically included in the PT at and around the action limit, or outside of the acceptance limits. We do the state of Oregon, state of Washington, and Canada all include the three that Tabitha is bringing to the table. And again, those states have specific acceptance criteria that we follow when we evaluate a proficiency testing study, and you get data points all over the board. That's what I mean by failure.
Yeah, I think he's just illustrating that it's a consistent challenge for labs across the board.
Okay, would anyone like to make a motion?
Make a motion. I'd like to make a motion that we exclude the three pesticides that Tabitha and Ryan Tracy have agreed to. Four pesticides in the list moving forward for the pesticide list moving forward.
And I'll second it.
Thank you. And Steve or Tabitha or Ryan, can one of you just articulate the names once more for the committee so that we can have it recorded for the motion?
It was dichlorvil.
Can you put them into the chat so you understand how to spell them correctly?
That would be great.
Give me a minute for that one. But I can, dichlorvos, acetoquinacil, as you say it, and the two pyrethrins is jasmine and cynarin, I think you say it, but I will put it into the chat the correct spelling as soon as that Polly can make here for me. But yeah, so acetoquinosyl, dichlorose, jasmine, and cynarin at this time. Like I said, maybe the next meeting or next year we can revisit and maybe get some studies on from the labs what they did not have DTEX for in the last 2 years that we could potentially move from the Arizona list would be awesome. But I know we need some historical data for that.
Thank you. So if I understand correctly, then the motion is to remove from the testing panel acetoquinosyl, jasmine, cynarin, and dichlorose. Steve, would that capture your motion properly?
Yes, that is correct.
Okay. And then I think, Sam, you seconded that motion?
I did, and I just have a question of clarification or a potential friendly amendment. When you say the testing panel, are you referring to both tables 3.1 in chapter 17 and 18? And if not, I'd like to further clarify that the motion would be consistent across both programs.
I'm just double checking that this covers both medical and adult use testing panels. Is that accurate? We're checking. Sam, I think at this time, based on the committee's charge related to medical marijuana, that we'll need to limit it to the medical marijuana testing panel. However, I know later in the agenda, we'll be talking about some of that concordance between medical marijuana and adult use. So we can discuss that further at that time in order to look at a recommendation within the final report from this committee about concordance on those two testing panels.
Understood. Then my second stance. Thank you.
Okay, thank you. Okay, all in favor of removing the 4 analytes from the pesticide testing panel, please say aye.
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 Aye. Aye.
Aye.
Aye.
All opposed? With a unanimous, apparently unanimous, do I need to do a roll call? No, okay. All right, the motion passes then with consensus. Thank you all so much. We'll move on. Tabitha, if we can shift back to you again to talk about residual solvents.
Okay, again, the same story. Oh, okay, I'm off mute. The same story with those. Don't remember how many we have to test, but quite a few. There are many that we have not seen DTEX for, but are not as troublesome as propane. Propane being the most volatile out of all of them, you can blow on a sample and it's going to be non-detect even if they did use it. I don't see why we're testing for this compound. It's very, very hard to, once you spike your batch QC when you're extracting, it's not necessarily extracting it, but when you're prepping your batch to get consistent acceptable criteria, especially when you're prepping and spiking much earlier than you're actually able to get it on your instrument. The rate of failure is really high. So you have to be really careful on when you spike and when you put it on. And that really, again, bottlenecks the lab. And the most likely, if you've got it ready 2 days in advance, it's gonna fail. Just the nature of, even if it is a tight headspace cap, you're gonna lose some propane and you're gonna go into failure. And y'all did give us a little bit more broader batch QC acceptance criteria for propane, but in a lot of instances, still, if we don't spike it pretty immediately and get it on the instrument or blow on it or sneeze, you're gonna lose it. So I really highly suggest we remove that one because you're never ever going to see that compound in anything that they're making their products out of. Again, there's a lot of other compounds, but not as troublesome as that one to get to pass. And again, we re-extract multiple times just because propane fails low and we can't report out that entire batch and we have to redo it. The cost for the lab to do that gets pretty pricey and the time it takes to do it gets pretty pricey. So anyway, I would like to suggest to remove that one for now, at least until we get some historicals on the other ones. But we've never even seen anything, a blimp in the baseline, nor anything above the MAL for that compound.
And just to echo that, the same stands from what we're seeing in our data. And to Tabitha's point, it is a negative impact to our ability to turn around samples and have our instruments running throughout the day and night, being that we do have auto samplers and they can run. To Tabitha's point, if you're not there right at the time to prepare this closing batch QC, quite often it will fail and you lose an entire half a day's worth of work and 5 hours of runtime on your instrument.
Hello, this is Maxwell from ASU. I got a quick question. So the current testing requirement, it applies for both or for all cannabis and cannabis related product, right? So basically, like whether you're talking about extract or flower, everything need to be tested for solvent, correct?
Flour does not need to be tested for solvents, I don't believe anymore. It did.
Just to clarify, thank you.
And Maxwell, just so you are aware, there is, as Sam had mentioned, there is a difference between the recreational testing program and the medical testing program. So those aren't directly reflective of each other. There are some small nuances and differences there.
Okay, well, thanks, Ryan.
Other questions, comments, or discussion related to the solvents and removal of propane?
Yeah, just to be clear, I'd like to understand. So you're asking to remove propane from the list or raise the limit?
Remove it from the list. Like I said, it's really volatile, meaning you leave it out, blow on it, you're gonna lose it in a sample anyway. And even when we spike it, it tends to volatilize super quickly. So we end up failing low on our instruments for it. The nature of it being in your guys' sample is you don't use propane to begin with, but even if you did, and it would probably be all volatilized by the time it got to us. And if it wasn't, it would be by the time we sold it to your patient.
Okay, thank you.
And just to follow up, what is the level for propane right now? What's the action level, like for medical and recreational marijuana?
I think it's 5,000 parts per million for propane. Yes, it's 5,000 parts per million. And I think my calibration, I start at, I want to say 100 part per million at the lowest point of my curve. And we've never even seen a blimp in the baseline in it for it, ever.
This is a really high action level, right? Because you're talking about ppm. And how often is being detected under the action level?
Never for this compound. We've never seen it at all.
Okay, all right, I understand. All right, thank you.
And Tabitha, I have a question, if you don't mind. You talk about, and I have no issue, I'm supportive of considering the removal of propane, but why propane and not pentane or just like the other ones that are on that list that might have similar volatility?
Because this one is the most volatile. When you run on an instrument, it heats it up at an oven ramping time. So it starts out at a low temperature to a higher temperature. And when the chromatography and the peaks come off, the most volatile come off at the lightest bit of heat. And then the heavier ones come off toward the end as the oven ramps up. Propane is the first eluter, meaning the very littlest amount of heat, it volatilizes and it shows up. So being that it's just a little amount of heat, even at room temperature, you can lose propane in anything, a sample, just leaving our standard out and not in the freezer overnight, we can be 50% decrease at lost propane. It's just a very volatile, it doesn't need much heat to evaporate. And so you just don't see it. So the likelihood of it being your sample when it gets here is you're not going to. Versus butane and pentanes and heptane and stuff is a heavier volatile compound. It takes more heat to get it out of your sample. So igniting it for a certain amount of time or keeping it in hot temperature, it takes more time for it to come out of your sample versus propane. Like I was being funny, sneeze or walk by with it, you're going to lose it right out of the sample because it's such a light light volatile compound, and it takes very little temperature to volatilize out of your sample. You just don't see it. So for us to get acceptable QC, like we can spike, we'll get a standard and it has all the compounds in it. We spike it into a vial and we run it. Everything comes up at 100%. You might, right when you do it, you might see propane at 75%. That's how quickly it volatilizes comparably to the other compounds that are in that standard. It's just super highly volatile compound. It doesn't stay in solution.
Got it.
I think another
really
thing to,
appreciate that. Thank you.
sorry, Sam. Another thing to consider is it's very low from a toxicity standpoint. So that's why the action level is pretty high. It's not a necessarily super deleterious compound. So from a safety
Appreciate
standpoint.
both of you on that. Thank you so much.
Okay, thank you all for that. Would anyone like to make a motion related to this discussion?
I'll make a motion to remove propane from the residual solvent panel, please.
I'll second
there a
that
second?
motion.
Steve, was that you? Sorry, I interrupted.
Yes, I will second that motion.
Thank you. All in favor?
Aye.
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 And any opposed?
Aye.
Okay, with one vote in opposition, the motion passes. Thank you all so much. And we'll move on to the next section of our agenda. This is related to the presentation of deficiencies related to testing. And I'm going to turn it over first to Megan Whitby in our dispensary program to talk about dispensary and establishment deficiencies. Megan?
Thank you. And I think we can have a report that we're going to share with all of you. It's the blue one, the establishment and dispensary report. So I have someone pulling that up for all of you right now. So there's a few things that we are supposed to include in this report related to deficiencies for marijuana establishments and dispensaries. And so you'll see the report shortly, and it's going to have a lot of lines on it that aren't a lot of fun to look at, but it's exactly what the statute requires of us. So it's de-identified data. For each line is a different either dispensary or establishment, and it will tell you how many statements of deficiencies that license holder has received that have testing violations on them. And then for each one of those SODs, it will tell you how many citations related to testing were on that statement of deficiency. This data is from May 2021 to November 1st, 2021. May is when we fully implemented our new electronic survey inspection system. So that's the data that we have available for you today. In that time, we issued a total of 73 statements of deficiencies to 65 licensees relating to testing. Combined, all of those statements of deficiencies have 154 citations related to testing. Of the licensees that received statements of deficiencies relating to testing, 25 were dispensary licensees and 40 were establishment licensees. For every one of those citations and statements of deficiencies, we did receive a plan of correction, and we have accepted those plans of correction for all of the deficiencies that are listed on this report that you have before you. So this will be included in the report that we submit to the legislature.
Thank you, Megan. Are there any questions for Megan before I turn it over to Steve to review deficiencies related to certified laboratories?
Yeah, if I may, Megan. So when we see these deficiencies and a plan of correction has been submitted, what is the progress or the outlook from DHS is how we ramp up the accountability and ensure as if it's a repeated or egregious violation that it's more than just the plan of correction. Typing out a plan of correction is one thing, but actually seeing it being upheld, enforced, and habitually adhered to is something I'm wondering if we're seeing a progress and improvement from the operators on that side.
So as with any other citation that we issue for our licensees, we do have progressive disciplinary action. So if they do have the same repeat citation multiple times, we have an enforcement schedule that may include fines that we would issue, civil money penalties. We could suspend a license or revoke a license. So we do have all of those available to us, but we do look at different things, including what the citation was for. Primarily, we don't have citations for people not having any testing done. A lot of the citations that we're seeing are, for example, that they had testing done by a lab, but some of the tests had a Q3 indicator because the lab didn't actually have all the approvals for all of those testing results. So all of that is looked into as we are citing these and determining what the next step is for them. But if we continue to see the same citations over and over again for the same facilities, then yes, there is progressive enforcement that will be taken.
And is that information available to us committee members or to the public as to who's received those and what the violations were?
So this report specifically that we're prepared for the committee, the statute requires us to de-identify the information.
Okay, thank you.
Yes.
Is it specific on the findings though?
The report tells you exactly what the statute required, which is the number of statements of deficiencies that each of the licensees received and how many citations that they received, as well as the outcome, which was accepting a POC. Now, we have launched AZ Care Check for the marijuana establishments because they don't have the confidentiality statute that our dispensaries do. And so going forward, we launched it about a week or two ago. And so going forward, everyone will be able to see all statements of deficiencies for all of our establishment licensees, including any testing citations.
Megan, will there be a chart, a category showing which dispensary, D101, D102, who that is?
So the statute required us to provide the report as it is, and it specifically required that we de-identify those establishments and dispensaries for the purpose of this report.
So that was a yes.
No, I think it's a no.
No,
The statute doesn't allow us to articulate the specific dispensary or establishment names.
Okay, so when I look at D102, there's 14 violations. Clearly, maybe somebody that's not following proper testing procedures. We don't have any way to know who D102 is as a customer and or as the public.
Not for D102s, especially because it is a dispensary and subject to confidentiality. But again, the citations for all of the establishments will be available on AZ Care Check going forward. And just keep in mind that I don't know specifically D102 what those were, but sometimes it may be that they missed something and they got cited for multiple different reasons, such as it being missing on inventory control, the label, different things. So it could be one issue that kind of has domino effect into different citations.
Thank you.
This may be a little off topic, but as we're seeing these deficiencies, and one of the, I think, frustrations from our standpoint, I'm sure there's frustrations on the other side as well, is the continuity or consistency from who is holding the dispensaries and establishments accountable, who's holding the labs accountable, and if all of those things are congruent and consistent between the two groups. So, you know, one of our commitments, and I'm sure the rest of the labs do this for their clients, is we want to aid them and help them in maintaining compliance and making sure they're getting all the testing and checking all the boxes that the program requires. And as we're giving them guidance, then we are seeing some inconsistencies in how that's being enforced on the dispensary and establishment side of things. You know, an example of this would be, let's say somebody has 20 different strains of flower. They're submitting one of the 20 samples for full panel and the other 19 for potency only, and claiming that the 20 different strains grown in the entire grow counts as one batch, where that's not substantial, that has no scientific basis. That's like having 20 kids and sending one to the doctor and assuming the other 19 are healthy. So those are kind of some of the things we see from an inconsistency standpoint, that as we advise our clients on, you know, the program and what's going to keep them compliant, then they have a different interpretation as they're allowed to veer away from, I think, the program as it was intended.
I will say there is a definition of batch in rule. And so when our inspectors are going out to the dispensaries and reviewing those test results, they are following that trail to see that everything lines up. Now, if you believe someone is doing something that is a violation of rule, we encourage you to file a complaint. And we do go out and investigate those. And just to let you know, on top of the inspections being on AZ CareCheck with all of the deficiencies, you will also be able to see all enforcement action moving forward against establishments on AZ CareCheck. So all of that information will be available to you.
And the example that I used for, how they're kind of doing the batching, I mean, am I correct in assuming that's not as intended in the program, that they should be testing all 20 strains for full panel, not 19 for potency and 1 for full panel, and defining them all as a batch? Because the batch language given was not written very well, and I was a part of that. Many of us were. We could have done better in that. But I think from the intent of the program, am I correct in assuming that they should not be doing that and should be testing all 20 different strains for full panel as they are different products? And the beginning of 1494 states that all marijuana products will be tested for. And these are in fact different SKUs, different product names, different prices. I mean, they're different cultivars or different products. So is that correct in me assuming that that is not how they should be doing their batching?
I would just say, I mean, we'd have to look at, I can't speak to that right now with the information provided and without seeing specifics and the actual batch definition in front of all of us. But I will say that those batch definitions during the rulemaking process were posted in draft rules and available for public comment several times throughout the process. But we know people have risen questions about it, so we can continue to look at it.
Why
Megan,
doesn't the definition include batch size?
I don't have an answer to that.
So I think a discussion related to batch, if it's related to the marijuana testing program, is something that we can look to add to the next agenda as an item of business if we want to have a further discussion on batch or the definition of batch.
Yeah, that would be excellent.
Megan, this is Sam. I have a couple of clarification questions on the report. Despite its lack of personal identification from a public standpoint, is it true that you as the regulator are well aware of the individual identities of those dispensaries that are in question in the report?
Absolutely.
And one other just question of clarification: of all of the statements of deficiencies that were delivered to those dispensaries and establishments, I believe you said it, but I just want to confirm, for each one of those deficiencies, there have been plans of corrections both submitted and approved by the department. Is that correct?
That is correct.
Wonderful. Thank you so much.
All right, thank you, Megan. We'll turn it over to Steve now, and he'll present some similar information related to laboratories and reports of findings and violations. And this should be the green document, I think, to pull up.
Can everybody hear me?
We can.
Oh, good.
We're just getting the document up.
So I'll give a little information. We're currently working with about 19 laboratories that are either fully licensed and others that are in various states of getting licensed either for a laboratory registration certificate or for certain parameters. So what you'll see is, for instance, lab number 1, what that's telling you is we've been out 3 times to that laboratory. We've issued or are in the process of issuing 3 different reports. As you see in number 1, we've accepted a corrective action plan for the first 2 inspections. We are currently in the process, that what the red asterisk means is that will be done by December 31st. And we plan on adding that into this report and having it ready for the advisory committee to submit to the governor and Senate and everybody. So those are in progress. And action is in progress. Generally, what that means is there is a possibility that there will be an enforcement action with that. So as we're going down the list, you can see there's been a number of inspections in different laboratories. One of those, as you can see, if it's in red, if you stop right there, that has already occurred. We have issued a consent agreement to withdraw the application for testing from the laboratory. That has been agreed on and signed between the laboratory and DHS. So you can see we have a number of deficiencies. That doesn't necessarily mean that they're bad. I mean, you can have one deficiency in where it's really horrible. So I don't think you should focus necessarily on the number of deficiencies, because it could be small SOP things that, like, the procedure, written procedure doesn't have these things in it, but they're actually doing it correctly in the laboratory. So you'd really have to look at the report to understand how bad some of these deficiencies are. If we keep going down, you'll see that. So the way to talk about this is, in the beginning, this report reflects data coming from November 1st, 2020 up to November 1st, 2021. So in the beginning, we were going into the laboratories, getting them ready to test for November 1st, 2020. And so what you'll see is, for example, with number 11, is that there's a number of different inspections. And what those could be is the laboratory is adding on different testing at different times. So that's why you'll see so many different inspections going on. And the action in progress, generally that's associated with the annual inspection. So we're now at the time where, starting in June of 2021, the department is now going back to the laboratories that were on board in November of 2020. And it's a very different inspection that we're doing. In the beginning, we were looking at a lot of quality assurance validations, method validations. And what you generally see is it's whether a lab has the capability to perform quality testing. At that point, we're not looking at actual sample testing. So now that we are going back into the laboratories, we actually choose randomly samples to review the data, how it's been received into the laboratory, how it's been tested in the laboratory, and how it's reported out to the dispensaries. So the annual inspections are much more comprehensive. We have found quite a few violations in the laboratories. And so generally, when you're seeing action in progress, that means that there is a likelihood that there will be some kind of enforcement action possibility. So again, we are currently in the process of doing a number of reports. And there you go.
Steve, this is Murray Stein. Can you speak to what you mean by there can be the possibility of enforcement actions? Short of removing their ability to test for cannabis, what other enforcement actions can you take?
So there's generally two types of enforcement actions. We could issue a notice of intent to revoke the license of the laboratory. That would be in the most extreme examples where there's numerous violations, and maybe they're repetitive violations that we're seeing. So that might be the case in extreme situations. At other enforcement actions would be civil money penalties. So the department is in the process of trying to work out a matrix table that has civil money penalties on it. And so that when we do move forward, the civil money penalties will be fair amongst and represent what should be given out as a penalty. And we wanted to make sure that we were holding off on that until we had gotten through a number of laboratories to kind of run it through the matrix. We're at the point now where we believe we're pretty much set with the matrix, and I anticipate that we'll be running a number of different things here in the near term.
Hey, I have a question here. It kind of comes back to the D102 dispensary number. As I look at this list, which is, let me take off my industry hat and put on my retail hat, quite alarming to see number 4 with 74 violations and 20 violations. How do we get these numbers? How do we get these names? I want to know who Lab 3 is versus Lab 2. I'd like to really know. It's only fair as a retailer that I have confidence in the analysis, the people that are doing my analysis, that they know what they're doing. Granted that they have done these, they've gone through the testing and they've gone through the ISO certification. Great, they know how to do their paperwork. But do they know how to operate an instrument, and do they know how to competently send out reports? Because as I see these violations, this gives me a pause, and it concerns me a lot, Steve.
So as you know, I started the environmental lab program in the early 90s, and this was pretty typical of that time. When you have a new program, generally you'll see higher deficiencies. I would say that in most cases, the labs have made great strides since November 2020. We have a few cases that there are major issues. So we, as a department, are working through those situations. I have great support from the department, and we'll see where everything is going to go with this.
So is it safe to say that we will never know who number 11 is versus number 2 versus number 4 as retailers or as people outside of the AZDHS organization?
Not on this list for this advisory committee, because according to the statute that was written, we have to, we can't have the name for this list.
Can we make a proposition to make that happen?
That would have to change the law. So we're just following the law for this meeting.
When are you expecting the matrix of civil money penalties to be issued?
I don't think you'll see the level of the civil money penalties, but we'll start adding those in. We're hoping to have all of this done by mid-December.
Mr. Baker, I have a follow-up question for you. So the N count on the dispensary and marijuana establishment side is relatively public. There are 130 medical licenses and 143 marijuana establishment licenses that have been awarded. And we saw in that report that 20 dispensaries out of the 130 were on that report. Can you identify what the total number of labs that is licensed to operate in the state is, and what portion of those labs are reflected on that report that you just shared with us?
So we have 18 laboratories on that list right now. We have a 19th that is we're tracking because they're just coming on board right now to get their registration certificate. So it's 18 of the 19 are on there.
Okay, so thank you. And then, so just to further clarify, the actions in progress, I think we're somewhere in the dozen range, 10 to 12 on that list out of the 18 potential had actions in progress. Is that, did I read it right? I didn't, it kind of went on and off the screen, so I apologize.
I think I'd have to look at it again, but I think it's somewhere more like closer to 8 or so. So, you know,
It looks like there's 12
12.
laboratories on this list that have an action in progress listed.
I'd also like to ask a question of, I don't ever recall this being confidential, this list of labs. No time in the rules did it ever state that it was supposed to be. So I'd like to know where that says that in statute. Otherwise, I make a motion to list all the labs.
Yeah, Steve, it's a little bit sticky. So you're correct that unlike dispensaries, laboratories are not considered confidential in statute. However, in the legislation that was passed related to this committee's charge and this committee's meeting, in presenting this information, we are required to keep the entity's names confidential. So in general, the laboratories are not confidential as dispensaries are through rule or statute, but for the purposes of this report and this meeting, the entities are confidential.
Steve, I have a follow-up question. Can you give us some examples of the major violations or minor ones so that we can get some ideas what is the gravity of the situation? The number doesn't mean anything, as you said, but I just want to see, you know, what are the major problems or minor problems that have been coming.
Well, I definitely don't want to get into too much detail, but some of the major ones we've seen many inappropriate practices that we would consider to be falsification of data. We've seen extremely sloppy testing. We've seen a number of very major things where there's no records to support that a sample was ever tested but reported. So there's a number of major things that we've found that we are working through. Most of the deficiencies, I would say that 80% of all the deficiencies are kind of a generic or around the process, maybe inventory control, SOPs, and training and different things like that. But there are quite a number of deficiencies that where quality assurance, quality control is failing, but being ignored. So there are many very serious deficiencies that we have found.
So are the labs with major problems still allowed to perform tests and certification?
So labs are usually have due process. And so the only time we would take an immediate action probably would be if there's an imminent safety issue right now. We do have the authority to go ahead and revoke the license and then go to hearing. And I know the attorneys are on the line, so if that's wrong, they can address that. But we work real quickly with the laboratories to make sure that certain things are not happening still. So we follow up and say to the laboratory, okay, we found this needs to stop right now. And labs are usually, we follow up on that too. So to make sure that they've stopped doing certain things. So,
Thank you, Steve.
Just a quick question. You used the phrase imminent safety or imminent health concern, or whatever that exact phrase was. Is that a defined term in your rules or statutes?
I don't think it's in the necessarily in the rules or statute there, but as a health department, we have great power when it comes to protecting public health in certain instances. So we would look at what kind of authority we have under the law and make decisions to protect public health.
And another follow-up question, and Steve, I apologize, be for you, but in the event that a lab who has been found, with some of these deficiencies, to have not disclosed that these, deficiencies or failures in testing happened prior to the delivery of product to a dispensary, who is responsible to the consumer at that stage?
I would leave that to the attorneys. What we're looking at is generally what we do with the laboratory on our annual inspections, our routine ones, is we will ask the laboratory to give us a list of every sample they've tested in the last 6 months or so and what it's been tested for. And then what we do is we choose 2 samples per parameter, and they're different samples. So we'll have 2 samples that come from maybe March or April or May for potency, and then 2 different ones for metals and 2 different ones for others. And we take a look at everything that is surrounding those samples from cradle to grave. From when it comes into a dispensary, we're tracking the chain of custodies coming in from the dispensary to how it's being tracked, how it's being weighed, how it's being tested, how it's being reported, how it's being disposed. So it's very comprehensive in our review of everything that surrounds those samples. Now, if we find something that with those samples that is indicating a greater concern, we then expand the review to sometimes much greater time period that we feel is necessary to determine what the extent of a problem may be.
That's helpful. Thank you.
Hello, this is Max from ASU. I also have a follow-up question. So now we have like another 6 items on our agenda, and it's quite a bit of detail to cover. I was just wondering, like before this meeting and our next meeting in December, we are going to get additional information on the item that we are going to make decision on, correct? Because we talk about quite a few things already today. Some of the information is my first time seeing it. I mean, I do have an understanding of the Arizona cannabis contaminant regulation. That's because this is my own research area. But like some other information, I would like to like have some time to read through it before the meeting. So we were just wondering if the department is going to make some information available. During this time, before our next meeting.
Max, are you speaking specifically of the information in the deficiency tables that were presented?
In January. Yeah, so for instance, like if you look at the 2019 meeting, there's quite a bit of, you guys did a really thorough analysis on all the 50 states, like different group of contaminants, and those are available, online. I was just wondering, for the purpose of this meeting, if we are going to make decision on, there's quite a bit of technical details to cover, right? So is the council going to have the information ahead of time before our next meeting, to read through it?
So I would put that to the committee members. If there are additional agenda items that you're looking to add to the next meeting, it may be helpful to fellow members to provide some information or background to the department that we can circulate out to the committee in advance of the meeting.
This is Murray Stein, and boy, am I glad you said that. I have, here, let me give you so you can see me. One of the big things we do is make edibles. And so we're in this food chain that includes pretty much everybody here. or you're representative of the folks that that we deal with in one end of the chain, whether it's starting with flour or concentrate all the way to the end where we're dealing with patients and customers. So we deal with a lot of data, and Tabitha will tell you that we're a double-edged sword. We're in her face and talking to her all the time. And that's great because we're really interested in the cannabinoids and all of that. At the same time, we ask so many questions. But I think we're all keen on getting where we need to go. And we'd like to share with you, perhaps in the next meeting or the one that follows, just some brief case studies of what our experience has been in terms of testing, in terms of working with labs. Nobody specifically identified. The analysis we've done over the course of hundreds and hundreds of tests, I think would be useful information to help provide guidance to the committee, and may also provide some support for where we're going to go eventually in terms of consolidating the testing programs. So I just, what I'd like to do is follow up from this meeting with those agenda items so you can put them out for discussion and see who else wants to contribute to that.
Thank you, Murray. I appreciate that. And Max, for bringing up that topic. We'll return to that at the end as we think through what our next meeting looks like in December and some of the asks.
Yeah, and also specifically the medical versus adult use requirement. That is a really important item to discuss. And if you guys already have some idea what, like that, the discussion is going to be focusing on, have any information, I would love to read those information ahead of time if they are available.
Great, thank you. So that's a request, and we'll talk about in the future too. But for committee members, if you're submitting agenda items, it may be helpful for other committee members if you can provide some background information you'd like the department to share out related to those. With that, we'll move on to the next section of our agenda, which is these additional items related to the testing program, and we'll start with the medical versus adult use requirements. Sam, if you want to go ahead and talk through some of that, that would be great. Thank you.
Yeah, absolutely. And I appreciate you and the staff putting this on the agenda for discussion and contemplation. And really this comes from the idea, and not just the idea, but really the nexus of the way that cannabis operates in Arizona is that the point of sale is the only point in the supply chain that product is segregated in terms of medical versus adult use everywhere else in our rule set, except for table 3.1. And the desire of operators is clarity and consistency across those programs, because with the exception of the recently awarded empty county, so-called empty county licenses, a large majority of our operators in the state are dual license for both medical and adult use. So it would be extremely helpful to consistency amongst operators, and especially on a wholesale understanding in that marketplace is wholesale operators are working with a variety of different retail partners, that there was consistency and a clarity of expectation as it relates to that. I know that we've already moved on from the aspergillus question in the testing, but what I want to say is the frame of that was the removal of aspergillus. So what I would say in a hypothetical is that the feeling of most of our membership and operator is that if the overwhelming thought from this council was that aspergillus needs to remain on medical, I would encourage us to consider adding it to the adult use rules so that there remains consistency across those programs. I know that some of the barriers of the consistency across programs were the kind of the statutorial and kind of rulemaking barriers that have been put upon the fact that we don't have a regular rulemaking process, and previously the medical rules weren't under that emergency authorization. But that's the frame in which I wanted to open up this conversation to the council. In the broadest sense, the two programs need to be as close to mirror as possible from my perspective, and wanted to see what the appetite was amongst my fellow council members to approach that, at least from table 3 perspective.
This is Murray. I just want to make a comment with regard to the edible impact of this. Certainly, anytime we can have a consolidation of the testing is going to be far more cost effective in making edible products that can serve both markets. So consistency of labeling and things like that is critical. Having said that, one of the challenges we have these days, and as all manufacturers do, is delineating edible products in a way that is 10 milligrams or less. Far harder than you might think. And it can force you to limit the kind of products you can make. Having said that, the challenge is that 10 milligrams, while we consider it a quote serving or dose, and is that's pretty much standard across the industry in other states as well. What do you look at when you call a dose in the medical world? We're getting ready, or have just introduced a 500 milligram product for medical. It's a single brownie. I can't cut that thing up into that many pieces. So things like the definition of a serving/dose should be different in medical. We need to take that into account. There will be some minor differences that we need to characterize, or we're going to create more trouble for us downstream.
And just to, I know that question might not have been for me, Murray, but just to clarify, that type of distinction is not what I'm looking to align. I think that there is definitely a separation, especially as it pertains to edible dosing and edible delineation, more so in other places of the supply chain, like the testing of analytes and the process for which those analytes are tested throughout the production supply chain.
Absolutely.
I have a quick follow-up question on this. I just want to clarify this particular agenda item. So are we discussing to have a separate? I'm just not clear about this. Are we discussing to have a separate testing requirement for medical versus adult use cannabis? Is that what we're talking about here?
Yes, and I'm sorry, that question might have been for our friends at the department, but since it was my agenda item, I'll just tell you, Maxwell, that essentially right now we do have separate testing programs for medical and adult use. And some of that is functional in the way that the initiative and the related statutes, Proposition 207, were passed and implemented with an already existing medical program. But as we're at this moment and with this testing advisory council, it was my view that we have an opportunity to discuss that, to see if there are any meaningful reasons why the programs need to be treated separately from a testing perspective. My contention is that they do not. And I would love to seek consensus on that as we move forward as a council.
Okay. Yeah, if that's the case, then I just, as a council member, I would like to request more information on this, because this is not clear to me. And, of course, my expertise do not cover all aspects of cannabis testing, but, it wasn't clear to me that there is a difference between the two. And at least based on my understanding, there's no other state that actually separate the two in terms of contaminant testing, so to speak.
That's correct. And I don't have the ability to screen share, I don't believe, and I'm not sure that the staff of the department has this available, but they did provide a very helpful essentially matrix that highlights the differences between the medical program and the adult use program currently. It's primarily focused around residual solvents, aspergillus currently, and then potentially, as we may discuss later, the heavy metals testing procedure as well. So those three areas are the main focus of my agenda item, but I think just as a general rule, I would appreciate consensus that on a go-forward basis, the two table 3.1s across 17 and 18 remain as close as possible for the perpetuity of the program.
On this note that we're talking about this, when the adult use first came out, got approved and it rolled out, I think the labs were under the assumption, it's a little bit different, but on the same topic, that we would be testing adult use pretty much the same, under our current license. But in May, and this might be a question for the state, in May, after a couple weeks after the testing requirements came out for adult use, we got an email notifying us that we had to apply for licensure to be able to test adult use. So I'm thinking, wait, 2 licenses? I got to get approved for testing medical and adult. It didn't make sense to me. We sent in a check, filled out the application. Given this was a couple weeks after they were required to start testing, that I got a notice I needed to be a licensed lab. We turned in everything. We got notification that the money wasn't necessarily a couple of months later, but we never got licensed for adult use testing, but the email said we needed to be. So who is testing with a licensed approved adult use lab? Because we never even got notification that we got approved or a new license number or that we were anything different than testing for medical marijuana. So I'd like to kind of follow up with that, because if the rules require them to test with adult use licensed laboratory, who's licensed for that? I know I applied for it 8 months ago and I haven't heard anything.
So I can address that a little bit here. So originally, I believe there was a misunderstanding within the department about what was required. And the initial thought was that labs had to apply for both. And after a review, it was determined that a medical marijuana laboratory was automatically able to test adult use products without a separate license.
We never got that notification at all. So we're thinking it's taken you guys this long to issue. And we've been telling clients we don't have a license for adult use if they're testing with that.
So I believe we sent out notice saying that we were voiding all of
The checks, but that didn't say that we didn't still need to be licensed. It just said to avoid the check. So I just thought there was no additional fee. You just give us a new license number.
Thank you.
That wasn't clear.
Excuse me. Thank you. Steve, I'll ask you to address this with Tabitha offline following the meeting, if you wouldn't mind, please. And we may need to do some follow-up with other laboratories as well, just to make sure that we have clarity on that. To return to Sam's discussion point related to adult use versus medical, and aligning the testing requirements on that, were there any additional comments or discussion?
I'd like to make a motion to make medical and recreational the exact same rules, fall under the exact same legislative rule package, and just be done with it. So whether it's adult use or medical, they all have the same rules. I don't know if I can do that or not, though.
We even allowed to do that, considering it's two different laws and programs? I mean, are we just here with the medical side, or are we able to address recreational as well?
You could make a motion to make that recommendation. It would be included in the report to the legislature, so it's something that they could consider putting in to align those requirements. Yeah.
If I could address that real quick, I'm sorry. I think Ryan, from a logistical standpoint, what's at issue is that, yes, this is the Medical Marijuana Testing Advisory Council. The issue is that it has previously been much more difficult to adjust this rule set than the Chapter 18 rule set. So by providing consensus as a Medical Marijuana Testing Advisory Council to align these programs as Table 3.1, that recommendation can be implemented by the department upon successful consideration.
Okay, thank you for clarification, Sam.
I'd like to make a motion to combine both adult use and medical tester cannabis testing into one rule, please.
I'd like to second that.
And can I clarify the intent of the motion, Steve? Is that related to the Analytes and action level list, or is it more broad? Are you looking to make a motion more broadly across medical marijuana and adult use?
I am making a broad request to encapsulate all required testing as one and make it whole. So medical and adult use are all the same, follow the same rules, follow all the same requirements.
Gotcha.
Seconded.
Okay. We have a motion and a second. All those in favor, please say aye.
Aye.
Did we lose some people? All opposed?
Aye.
Did I hear an opposition there?
Yes.
Okay, thank you. Can I just do a quick check to see if we still have quorum? Can you let me know how many folks are on the call?
Jay Neary still here.
Okay.
Steve Cottrell is still here.
Okay, we're good. Thank you. I just didn't hear a lot of folks chiming in. We're good. Thank you. Next, I'll turn it back over to Sam to talk about procedures with labs without all approvals. I'll also make a note before Sam starts that this is one of 5 remaining items on our agenda. So just let's be thoughtful as part of these discussion points. And of course, we can move things forward to the December meeting if we need to. Sam, please go ahead.
Absolutely. And I think to your point, Jessica, I think this might be something that is perfect for introducing here and maybe discussing further at December, because the question is a bit nuanced. And really it has to do again with the theme of consistency and certainty amongst operators. A couple of months ago, the department put out an additional column on the regularly updated list of approved and certified labs that indicated full scope. But that full scope term was undefined, and it didn't necessarily indicate that there was any certainty that if you chose that lab, that the entirety of that test would be accurate, nor did it communicate that if you wanted to arrange with one lab that did not have a full scope included, that you were like not allowed to use that lab. So in essence, to use maybe a helpful analogy that is often talked about in other government circles, it felt as if maybe the state was picking winners and losers on that list. But the reality from a logistical implementation standpoint is that it added a lot of confusion amongst operators. Like, who do you use if they're on this list? Are they allowed to be, you know, somebody that we can bring our samples to, et cetera? I think also in further learning about this issue and some of my own due diligence, I found that it is a part of an ISO requirement to identify other labs that are required to reach that full compliance. So I think that's required in the ISO certification, but I think bringing what that process is a little bit more to the light from an operator standpoint is something that we would really, really appreciate. And it was said in a different agenda item in terms of, like, you know, you're testing one cultivar or whatever, and you're using others. I mean, I have 2 children, they go to different schools. I think that, you know, the state has always done a really good job about letting the market kind of settle itself, and the use of multiple labs is not necessarily something that you ever wanted to get in the way of. It's clearly explicitly available as an option in the rule set. But I think that the question of that full scope designation or what the business side of working with labs look like is lacking. So I don't necessarily have a solution to offer other than to identify that the current identification of full scope is not something that is as helpful as I think that the intention was. And I would love to have a conversation either today or in December, once folks have a chance to digest some potential solutions to talk about how to get that.
So this is Steve. I don't understand what you're talking about. So on our website, we're very specific, I believe, on what lab is what they're certified for, what parameter, even getting down to what instrument when it comes to some of the PCR tests and all. So I don't think we put full scope. If you could give me more information, I can go research this, but I don't think that is the way we present the data or what labs are certified.
It's there, Steve, there's a final column on the certified testing list that says full scope, and then there's a check mark next to that for some of the labs. I think that might be what the question is about.
I think that just to us, it just told, you know, that we had everything that the state required we were able to test for. That's what we contributed as, since ours had a check mark and others, since just we had everything that the state required for all the parameters.
I think, and Tabitha, to your point, I think that there is absolute clarity for you and some of your colleagues that have that full scope check mark. But I think that there are some questions about, some well-established labs that might not have that full scope because they made a business decision to not do heavy metals or not do one of the particular tests, but have a well-established relationship with someone who can perform that and offer a streamlined COA. But the check mark has added significant confusion in the marketplace and has also kind of offered like a seal of approval that I think might be inappropriate at this stage, because the rule set explicitly allows labs to kind of offset that. And, my concern here isn't necessarily the well-being of the labs, but the well-being of the dispensaries. And I think that that confusion about who you can and cannot use is something that I just think needs some additional clarity. And like I said, I don't have a solution to offer. I would just love to make that recommendation, find a solution together as a group.
This is Murray Stein. I just want to add that, we deal with downstream issues when a buyer or a dispensary raises an issue where they get multiple COAs. And in our process, we have a initial full panel COA on the kitchen concentrate, and then a final test on microbials and potency. And that's fairly efficient. It's cost effective for our model, provided our batches of edibles are large enough. Where we run into trouble is that if we don't get a clear full panel from one supplier, in other words, if I have more than one COA for that initial kitchen oil, such that it went somewhere else to do residuals and somewhere else to do something else, it becomes really confusing at the tail end for the buyer at the dispensary. Frankly, the fewer COAs we have, the better. But at the end of the day, I personally don't think any lab should be certified to test for cannabis unless they do the full suite of all full panel testing. I mean, everything that is required by the state, they should do before they're allowed to jump out there, because it does create confusion. It really does. One thing I want to add as well is when we do remediation, and in our circumstance, we can work with intermediate oils that allow us to do that before we actually dose an edible to manufacture, we can run into real challenges in terms of the latency that a lab has with regard to, you test at lab A, maybe you're too high or too low, you send it to lab B to see what their results are. You wait for that before you have to send it to lab C. Well, I'm now, 3 weeks into this, given the current turnarounds of labs, and my product shelf life has just gone in the dumper. So I think there needs to be some discussion of remediation testing and how we can do that better and more efficient. Back to you, Sam.
Okay, thank you for the introduction on that topic, Sam, and we can certainly have additional discussions or conversation about that in the future. We'll also take it back internally to take a look at that column and see if we've got other suggestions as well. It looks like the next thing to Murray's point when he was talking about certificates of analysis on our agenda is related to standardized certificates of analysis. So I'll turn it over to Joe to talk a little bit about that, please.
Thank you very much. I appreciate it. So for the standardized certificate of analysis, I think, obviously every lab has their own proprietary sort of situation and reporting, and definitely don't want to mess with that. I think that for the patient, however, and I'm guessing for the dispensary as well, it would be very simple if there were a standardized sort of cover letter that specifically lists the analytes that are statutorily required to test. And I think that would just really simplify things without really messing with any of your, reporting or anything else. So I was curious what the labs and what all the operators think about that.
I think it's a great idea, and I think it's a great idea for a number of reasons. If I put my retail hat on, when I have a product that comes into my retail locations and it has an N1 on it, we historically will just automatically refuse it. Well, that N1 just happened to be for terpene analysis. So that's not even a state required test, but we refused it because we see an N1, because we're going to get called out by our state inspectors for having N1s in our analysis. So if we were to have that Q or that cover letter stating all of the state's required tests, it would make it so much, so my employees are able just to look at it, do all the boxes checked. Yes, all the boxes check, and then we can go in on the back end and look at the terpene analysis or look at the water activity analysis that are all N1s, not required, and not really have to deal with the refusal of product, if you will.
Steve, I think, having a friendly conversation with your lab and explaining the lab report would be useful. I mean, we try to, in all words, dumb it down and make it as basic as possible for everybody to read. I know on our reports, our first page is everything that's regulated. Second page is everything that's regulated. We are required to put a Q3 on anything that's a non-regulated test. If it's terpenes or water activity, by law, for Steve Baker, I messaged him one day and asked that I have to put that on there. We have to. So you guys declining N1s or Q3s on other tests, those are required of us because they're not regulated testing, that we inform the client that it wasn't done with regulated testing. But if you just have a friendly conversation on how to read the report and explain the report, it is quite simple. The first 2 pages is all regulated tests. You can't fit it all onto one page, all of those tests. So typically, the first 2 are going to be regulated tests, and the last page is going to have all your qualifier information on it or additional tests that you order. And in most cases, these are the COAs that I see. They all look alike. They all have the pass or fail. They all have the same required information because the state has already put that into the rules, what we're required to put on those COAs, and it's all there. And now, if it's difficult to read, like I said, I would suggest just having a conversation with your lab, explaining those things. I mean, for a patient, it's going to be even harder because it's not something that they look at every single day. But for us to look at it every day, when I look at, Delta Verdes or C4s, it's very similar. All the same information is across the board on what we have to put on that. It just depends on what pages I guess it goes on. But everybody should be quite standardized because we're required to all have the same information.
I agree, Tabitha. I'm just trying to ease of operation here for, let's be honest, we're not, well, many of our internal employees that understand how to read these understand how to read it. But when we're working with the general public and they pull up a testing analysis, now we're talking about a whole bigger, conversation of educating customers on how to read these analysis. And if we were just to have a standard cover sheet from APDHS that they made, and everybody just fills in the boxes, whether you're testing with company A or company B or company Z or X, it's all the same cover sheet, and all dispensaries understand how to read it and articulate the message out to the customers. So
I want to add to what Steve says, because this N1 thing has bit us in the butt. We've had returned product, and we've had so much as to have to send multiple people from our quality department up to meet specifically with buyers at dispensaries to explain this to them. So it really is a pain point for us. And, we've talked at length to Tabitha. She understands, and I definitely get her point about the conversation. But, there's turnover in these companies and stuff like that. I may be one of the few people that's actually really kind of interested in the terpenes because we're curious about what they do. A lot of folks don't test for it, but those that do, we don't want to have to run a separate terpene panel from our full panel. So if I do deliver that full panel, it's got terpenes on it, I get a rejection. So it is a problem.
So Steve, if I can clarify, are you suggesting that the cover letter just show that everything has been tested for what it's been tested for, or are you actually suggesting that it have a summary of the data and pass or fail for those individual panels?
Summary of the data, pass and fail, and much like you're already doing. However, your test, your cover letter is different than Tabitha's cover letter, which is different than Delta Verdes cover letter, which is different than On Point's cover letter. So we need to have uniformity in that cover letter only, because once you dig into the back end, you all have your own methods for how you read your data. And that's fine. I'm just talking about the cover page, and that is the only thing that buyers and customers have to worry about reading. Did it pass all these analytes? Pass, great. Does it have the potency I'm looking for? Great. Did it clear all of the mold? Great. And that's it. Anything else, whether it's N1 or Q3, because it's terpene analysis, water activity, is not important for any of the buyers to see. And that just goes on the back page.
Yeah, I want to just really echo what Steve's saying right there. I should be able to, as a consumer, walk into any dispensary and buy any product and ask for, the results of the test and have it be a very standardized, readable sort of situation. That's going to be the easiest situation for patients and for consumers. And it sounds like it'll be somewhat helpful for dispensaries. So that's really what I was shooting for.
Yeah, I've spent hundreds of thousands of dollars over the last year testing. And
What?
the retests to get rid of Q1s is a pain. It is definitely a pain point for me, as it is for Murray, as it is for anybody that has a wholesale business. As we go out to our customers and try and sell our products, it's a big pain point.
Is it possible?
Thank you, Steve, and thanks,
On
Murray.
top of every-
I wanted to just ask very quickly, we have 15 minutes left. It sounded like, Tabitha, were you going to make a final statement here, and then we'll wrap this topic? Was that not Tabitha?
I'd like
I think
to
it
make,
was, but she looks frozen.
He's frozen.
And I don't mean to like take us away from moving on, but I just want to highlight that I think at the crux of this question, and maybe a handful of others, the bigger issue at hand is that the way that our program is set up is that the retailer dispensing or selling the cannabis is liable, and that has for that sale and for that product, and that has shifted a lot of the conservatism to the buyers on the wholesale side of things. So what would be beneficial in this agenda item is that it would add clarity in the wholesale marketplace, as well as adding clarity to the end consumer, and a quick read on what the COA is inclusive of. Those are the two bigger areas that I just wanted to highlight there from our perspective as operators.
Thanks, Sam. Tabitha, I think you're unfrozen if you want to make a quick comment before we move on.
I don't think it's going to be the lab's responsibility to dumb down a COA when on the very top of all of our COAs, it has a pass fail for everything but potency. I think that's as clear as day, pass or fail, even if you don't understand all the compounds and what the results actually are. I think every report up there has it, except for potency, which is not a pass or fail, it's just a number. So I don't see it getting any easier than that. And I don't see why a dispensary can't make their own little format of a page, making it easy for a patient to see. If they want to see the raw data, you prove the COA, but I don't see why you guys can't make your own little pass or fail if that's what they need to see based on our COAs. I don't think it should be something that we're required, because we have everything on our COA, and and I just think you guys need more clarity and education on how to read them, even if you do have a bigger turnaround within your establishment. I mean, they're not hard to read. It's just, you just need to talk to your lab about how to read them.
yeah,
Thank you, Tabitha. I appreciate that. We'll move on, but we can add this to the next agenda item as
I would like
y'all
to add it to the next
crystallize your
agenda item.
thoughts, and so you can think through what you want to do, and if there is a recommendation that this council would like to make to the legislature. As an aside, I would state, and we've talked about this in prior council meetings as well, not everything is necessary to be put into rule to have the department regulate. And so I would just encourage you to think about that as well as you're considering making recommendations for any changes to rule, and how much regulation you'd like to see from the department versus within the industry itself. I'll turn it back over to Joe for the next item on the agenda related to recall processes.
Thank you very much. And just, again, this is another one of those that I just wanted to kick out to the group. I think from the perspective of a patient, the trust that I have with my medical marijuana dispensaries that I go to is really important. It's a paramount item for me. And, if anything were to potentially diminish or shake that trust or that relationship, I'd want to make sure that it had gone through a vetted and proper sort of process before I was alerted as a patient. But at the same time, we need to make sure that if there is an imminent threat to patient safety, that they're alerted as quickly as possible. So I just would hope that the group could ask ADHS or the legislature or whoever to come up with some sort of standardized recall process that's fair, balanced, checks all the boxes, frankly. That's really kind of the idea behind it. So I'm curious what the council has, if any thoughts on that. Okay, so just for the sake of time, would it be best if I made a motion for the council to recommend that DHS come up with a fair, balanced, and transparent, vetted recall process.
I would second that motion.
Okay, so we've got a motion on the table here for ADHS to come up with a fair, balanced, and transparent recall process. Is that what I've heard?
Yes.
Yep.
Yes.
And a second. Sorry, Sam, you were the second on that, right?
Yes.
Okay, perfect. Thank you. All in favor?
Aye.
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 Any opposed? Okay, thank you. That might have been the quickest agenda item we had. Thanks, Joe. Tabitha, I'm going to come to you next related to lab procedures, please.
It appears she's frozen again.
Oh dear. Okay. We'll give her just a second. We have 10 minutes left. Just again, while she's getting unfrozen to summarize for folks, we will be looking at the next meeting to summarize the discussion from this meeting. We've got a couple of agenda items we talked about at this meeting to throw on to next meeting as well.
Can you hear me now?
Yes, we can. Perfect. I'll just
Sorry,
finish
I don't
this
know
and then
what
I'll turn it over to you.
Okay.
And then we'll be looking at our report as well for the legislature based on some of these discussion items as well. Those of you who were with us 2 years ago may recall we had a couple of placeholders in the report that we added in after the final vote in our December meeting last time as well. So we'll be looking towards that, and you'll see some updated inspection reports and corrective action tables as well, since some time has passed since then. Tabitha, go ahead though with lab procedures.
Okay, this is gonna be real quick, and probably the only one that can probably maybe offer some insight. It's gonna be Ryan and Steve Baker. This is mainly for you guys to digest and maybe make some decisions on. I don't think we'll get any votes for it today, but when you created the rules, you based it, I think a lot, because I've done drinking water all my life, is a lot of really stiff drinking water rules, and I would consider this product more of a wastewater type rules that, ADHS usually guides to. So I was thinking, like, some of the things that you guys have, like, for instance, there's stipulations on how we create our calibration curves around the MAL and our CCDs around the MAL. I don't see why we need to do that when we can just create our curve however we choose to and be able to dilute down a sample. It would make our lives much easier, be more cost effective, and just, it's really chaotic rule for us to kind of guide by for all of the different tests. We do it in drinking water right now. We don't have any stipulations on how we make our curve, and just dilute the sample down into the concentration range to be able to report it accurately. So I wanted to reconsider that whole rule, and you know what I'm talking about, Steve, with the calibration curves and the CCDs meeting the MALs. I wanted to also suggest that the batch size, considering the amount of samples that we run, and again, because I think it's more of a considered wastewater, but you know what I mean, versus a drinking water regulation type thing, that we increase the batch size from 30 from 20 right now, considering the amount of batches that we do and all the additional runtime we have to do with the batch QC that currently is in the rules. The third one I want to suggest was the matrix spike. Again, a matrix spike per 20, the same drinking water regulations. Again, I would say maybe go along how like the 600 series wastewater does, maybe 20% of the sample volume that we get, or at least once quarterly. I think we have enough historicals with matrix spikes to know what passes, what doesn't pass. And currently too, we're able to use historical limits. I don't see what this information is really providing, considering we get cannabis in all sorts of different matrices. To be able to build good historical data on any of these is really quite difficult, considering too all the different recipes and how they make these products. I don't see how matrix spikes is should be required to do this per batch. LFBD, again, this isn't drinking water we're talking about. I would say maybe quarterly, or on a different basis than with every single batch that we do in LFBD. We do so many batches a day. We've got reproducibility across the board, but one per batch I thought was quite steep. I wanted to be able to, because most of the LFBs and LFBDs are extracted, not residuals per se, but I wanted to see if we could consider using historical limits for all compounds, because it isn't instrument QC, it isn't extracted QC. That would, again, because it's not just flour or concentrate. A lot of these are medibles and things that we have to do LFBs or run this LFB with those batches, and it can cause the instruments to kind of be all over the place. So I think some broader LFB B and LFBD ranges for extracted batches would, or allow us to use historicals would be more idea. And also I had asked about this before, but there is really nothing in the rules. So I'm always really skeptical about doing this, but we asked if anything was over the MAL, if it was necessary to dilute it down 1,000 times or however many times to get it on our curve to be able to report it just above the MAL. And you allowed us to write greater than the MAL. I just think something should be put in the rule that kind of covers us if you ever do call us out on that we are not diluting a sample down to get it under that MAL, because we were doing multitudes of dilutions on pesticides just to be able to in fact report it greater than the MAL, just to come up with a number. So those are just some of the things that I wanted to suggest that maybe you guys reconsider. You know, right now it's more, I think that you're guiding us with the quality assurance that of the lines of drinking water standards. And I think that maybe considering too that we have a lot of historical data with the labs, the matrix spikes and the LFBDs coming in for reproducibility quite consistently, that we can maybe not be so steep with some of those rules, because it is very costly to do that. And it's not really, the matrix spikes is not contributing to anything considering all the different matrices that we get. And the last thing, and again, this is just something that state's gonna have to reconsider. I don't think I get any votes on any of this unless Brian says, hey, pay me. But anyway, the E. coli testing thing, the last thing on my list was if we're required to test for generic E. coli instead of the pathogenic 01557H7, which is the strain that is harmful to humans. And the thing is, why are we allowing any number when E. coli, because there is no expiration date on our test results, this product that we tested for E. coli could be under 100, sure, but if it got picked up on the shelf a year from now and those test results still are valid, you can definitely have more than what we tested for. So my suggestion is either to change the type of E. coli that we test for, or putting expiration dates on the COAs, or having a pass fail, yes, not having an actual number that we're saying that's a pass or fail. Those are simple ways to resolve that, I think, but that would be up to everybody else to coming from on that matter. But I hope I explained that okay.
So I will
That's
be
it.
very brief, Jessica,
Thanks,
so
Steve.
that we have already come up with edits to the rules, and a number of these are already going to be go into place if we can get to rules. We lost exempt rulemaking, I believe, like January 15th. There's a little bit of room to make rule changes because of the adult use statute, but we have already submitted a number of changes, and those, the calibration curve thing and the levels, that's already in our edits to remove all of that, so that you can have calibration curves where you want, you can have the standards at what levels you want, probably mid-level. We don't want them at the top or the lower the high. We're already looking at the possibility of getting rid of matrix spikes altogether. We might, there's a number of things. We put some of these things because other states were doing these things. And so we were trying to be a little more consistent, but now that we're in about a year into the testing and we see the results and what's going on, there's a number of things that we're going to propose in the rules. And if or when we get to rules, I'm in the queue, I believe. There's a lot of really important rules being written in the department for a lot of things. If I can get to rules, I think we will also send things out for comment and discussion. And I think most of the labs will be very happy where we're going.
And Steve, did you also include expanding batch size, laboratory batch size on that?
We'll have to talk about that because I've never seen anything over 20, but we can talk about that.
Okay.
Okay,
Yeah,
so-
I think for certain analyses, we can certainly expand that and still maintain the integrity of the program.
Sure. Well,
So I'd like to propose, given the that we're running up against the time now that we can put the E. coli conversation, Tabitha, and this batch size conversation onto the next agenda for discussion. We also discussed today moving over the standardized certificate of analysis discussion if folks want to continue that at the next meeting, as well as the definition for batch. Made a number of motions today, so thank you all for your engagement there. I would just encourage all council members to consider, as Max initially brought up, if there are items that you're looking to get on the agenda next time, feel free to email us today or tomorrow or the next day with that item and any background information that you'd like us to provide out to the council with the next agenda in advance, so folks can have some preparation to think through some of the items that we'll vote on. Our next meeting and the final one for this year will be December 16th, I believe. Yeah, December 16th, 7th. It's in December and it's on your calendar already, and we'll send reminders out for that. I appreciate you all for taking the time with us today, for submitting all of this information for a robust agenda, and for your discussion points. Thank you all so much. And can I get a motion to adjourn, please?
Second, motion to adjourn, please.
Second.
Second.
All right, thank you.
Thank
Meeting
you,
is adjourned.
everybody.
Have a great day.
Thank you.